is Courtney Simmons. I'm a registered nurse on a medical surgical floor with extensive history in long-term care. Across the United States, the number of home care aides has drastically decreased. However, due to the baby boomer population, the number of disabled and elderly Americans is significantly increasing. With the average salary of home care professionals being below poverty line, workers are obligated to find higher-paying jobs in order to survive and eliminate the need for public assistance. The Minnesota House of Representatives is proposing Bill 464, which authorizes certified paraprofessionals to provide home care while seeking federal reimbursement for their service. This bill also creates a working group to study the workforce shortage in home care. Implementing this change will increase the number of employees in home care and will also improve the quality of care given to individuals in need.
As you can see on this slide, this bill was introduced by many senators and representatives, including Senator Jerry Ralph of District 14 on January 23, 2017. After being sent through the Committee of Human Service Reform, then to the Committee of Operations and Elections Policy, it is now in the hands of the Committee of Rules and Legislative Administration. This bill is aimed to authorize certified paraprofessionals to provide home care while seeking federal reimbursement for their services. It also gathers a group of working individuals to study the healthcare shortage in home care, which is the biggest issue today. Overall, this shortage of paraprofessionals affects the quality of care given to our patients. When looking at this issue, we also need to recognize the role that organizations play in home care. According to Rogers, the average Medicaid reimbursement rate for healthcare companies is $17.70 per hour. This salary does not directly go to the caregiver. It is given to the organizations who use a portion of the profit for rent, insurance, educational training, and paid time off before it is given to the employees. This makes the average salary in the United States of America for home care aides $9.83. As we can predict, this low-income job has a 60% turnover rate. I am sure many of you are wondering why it is so high. This is due to the non-competitive wages, long hours that commonly exceed 40 hours per week, and the demand of physical, mental, and emotional health. Our goal in passing Bill 464 is to improve reimbursement rates for home care employees while reducing the gap between healthcare staff and patients. Looking closer into the issues with home care, we can note that the majority of problems stem from the lack of reimbursement. According to the CDC, there were about 67,000 paid long-term professionals that served over 9 million people in the United States. Out of these professionals, 12,400 were working in home care. Susan Heavey recognized that 1/4 of these aides are living in poverty with a median salary of less than $21,000 per year. These jobs are so unappealing to the reimbursement rate, it is hard to keep workers. It is evident that by 2040, there will be over 50 million Americans requiring long-term care without the increase in reimbursement. Our family members and friends will not receive the care they need. Along with that, the quality of care will decrease due to the inadequate staffing, rushed home care aides, and caregiver strain and burnout. As stated earlier, we noticed a severe problem with organizations and Medicaid reimbursements. Due to home health organizations taking approximately 45% of the given wage, home care aides are making about $9.83 per hour. Without an increase in federal reimbursement, organizations will not be able to hire more staff to eliminate the deficiencies. This section is a continuation of the previous slide, addressing the major concerns with the lack of reimbursement, while also providing some background and history. Understanding the job description of home care aides is crucial in understanding the demand. Home care aides help with activities of daily living and instrumental activities of daily living, including assistance with bathing, dressing, grooming, hair care, nail care, oral care, as well as housekeeping, laundry, and meal preparations. These services assist individuals to improve or maintain an optimal level of physical functioning and also quality of life in their patient. In 1938, the Fair Labor Standards Act was passed, setting 8-hour days, including extra pay for overtime and other safety standards. However, this law excluded domestic caregivers, including home health aides, resulting in extreme burnout and no equal pay. In 2015, the Department of Labor demanded minimum wage and overtime for home care aides under the FLSA. Historically, the majority of United States medical care was provided by nurses and physicians in the home. It was as early as the 1790s that visiting nurses provided nursing care to the poor, mainly mothers and children. As we learned in class, Margaret Sanger demonstrated a strong example of home care nursing. In the early 1900s, concerns about protecting public health and preventing spread of disease prompted many community organizations to send visiting nurses to homes. As the years went on, advancements in medicine began to shift healthcare. All of the new technology required space and maintenance that could only be provided in hospital. Along with that, physicians started to specialize more and offer their services in centralized locations. Over the years, the increase in cars and public transportation has allowed patients to travel to and from the hospital. By the 1930s, most care of acutely ill patients were transferred to hospitals, while visiting aides and nurses provided long-term care in the homes. The Medicare Act then passed in 1968, providing funding for home care. There are many populations that would be affected depending on the passing status of the Minnesota House of Representatives Bill 464. Looking at the populations that would be impacted if the bill was not passed, our vulnerable individuals would be in this category. These include the parties that benefit and require home care, such as disabled Americans and the elderly population. If this bill is not passed, home care aides would also be affected, resorting to new jobs and potentially continuing to work as an aide in poverty. However, looking at the population that would be affected if this bill was passed, we would see taxpayers. The government may demand more tax dollars to increase home wages. Small businesses would also be affected. The government may take money from their organization to provide for home health organizations, leading them to potential bankruptcy. The last group that would be affected if the bill was passed would be the federal funding organizations, such as Medicaid and Medicare. These organizations would be required to give more money to home health organizations. Depending on the status of the bill, we have learned that many populations would be affected. This goes hand in hand with unintentional consequences. If the bill was passed, our taxpayers, small businesses, and federal funding organizations would be affected, potentially decreasing their organizations or business funds to increase the funds sent to home health organizations. The government may also charge more through taxes to develop the money needed to increase home care reimbursement rates. However, if the bill was not passed, we know that our disabled and elderly population would be greatly affected. The unintentional consequences would be the needed individuals would not receive the care they need, workers would continue to be living in poverty requiring public assistance, and health aides may develop emotional, physical, and mental fatigue and burnout due to long hours and extensive assignments. Regardless of if this bill is passed or not, there will be populations affected and unintentional consequences. As an advocate for this bill, we need to look at the needs of our community to see the benefits of the bill passing and see how this outweighs the negatives. The financial implications of this bill are interesting. In Minnesota, 53.8% of healthcare spending is from private funds, while private insurance account for 38.9%. The House of Representatives reports that $633,000 will be spent in 2018 and $559,000 will be spent in 2019 to regulate health care and long-term care. Healthcare spending in Minnesota will grow by 7.8% per year and is set to double by 2023, reaching $85 billion. Learned in class this far, stakeholders are extremely important in the policy process. These key individuals have a strong connection with legislation and representatives to influence their decision process. As we can see on the slide, there are many organizations and associations that support and oppose the passing of Bill 464. The National Association for Home Care and Hospice is working to develop compensation models that could resolve barriers to accessing care and is also working to increase wages for home care aides. The next two, Home Health Nurses Association and Minnesota Nurses Association, are working on developing contracts to increase wages while promoting awareness of home care. The biggest supporting stakeholder is the American Association of People with Disabilities. This association works to reject proposals making radical structural changes to Medicaid. These changes would make healthcare unaffordable and also would potentially harm the older adults and people with disabilities, since they would not be able to afford the necessary care. The organizations that oppose the passing of this bill are small-town business owners, federal funding organizations, and the American Conservative Union. Medicare and Medicaid believe that increasing wages would make home care more expensive for families and government programs. These programs would be required to upfront more money, decreasing the amount of services they could cover, putting the needed population at risk for financial concerns and harm. Again, small business owners oppose this bill since it takes federal funding from their organization to increase reimbursement for home health workers, overall impacting their functioning ability. The biggest opposing stakeholder would be the American Conservative Union and the Home Care Association of America. Increasing the wage for workers would lead to fewer jobs. It would have failed to make life cheaper for workers. Also, the middle class would be greatly affected by increasing the cost of services. Many healthcare organizations would not be able to afford the increase in salary, charging patients and family more money. Overall, we can see the roles that each of these stakeholders play in the passing of Bill 464. To sum this presentation up, I am a strong supporter of the House of Representatives Bill 464. With the increase in federal reimbursement rates, I believe that there will be a decrease in public assistance, decrease in job turnovers, increased home care workforce, and healthier and happier individuals that require assistance. These hard-working professionals are entitled to livable wages, as is everyone else. As a registered nurse, I am not only an advocate for patients, but also for families and other employees. Making slight modifications to this bill through extensive research in other states would only make it stronger. Working to eliminate the middleman, such as the organization, would allow workers to be reimbursed for the services that they provide at a rate they deserve. Using a direct employee model operated through the state would help with this process. Oregon has significant success with this process. Caregivers are matched with clients through registries operated by both the state and the county. The state government then determines the wages, issues the paychecks, and handles all of the administration work. This eliminates organizations such as Synergy Home Care, Dependable Home Health Care, and Divine Health Care, directing the funds straight to the aides. In Oregon, the implementation of this model increased home health aide salary by $4 an hour. To determine if this proposal would be successful, we will notice an increase in home care aides and also the satisfaction of workers. Although this model would potentially eliminate office jobs in healthcare organizations, the benefits again outweigh the risks. As we can see, a poor quality of healthcare along with reduced access to home care have been linked directly to increased adverse effects, such as hospitalization, emergency room visits, an intensive probability of health deterioration, and prolonged recovery times. The reimbursement rate for Medicare and Medicaid is insufficient, and with the lack of increased salaries for these professionals, the turnover rate will continue to rise, leaving these patients in need without proper care. Now is the time to step up and protect all citizens. Advocating for Bill 464 is just one step in improving this critical issue.